Knock, knock, knock.
Come in.
Hi, I'm Chelsea. I'm going to be your nurse. I did your vitals earlier, but I want to do a head-to-toe assessment. Is that okay?
Yeah.
Okay. I'm going to wash my hands and provide some privacy. And can you please tell me your name
James Carter.
and your date of birth?
12/25/01.
Okay, I just want to look at your bracelet, make sure. And do you know where you are?
No, also
Okay. And today's date?
5/12/17.
Okay. Alright, so you're alert and you're oriented, you're in an upright posture, you answer appropriately, and your hygiene is good. I'm going to feel the top of your head, make sure there's no tenderness. Okay, you're alright. And there's no bugs. And then I want you to look at a spot on the wall and just keep over there. And just keep looking at it, and your pupils are round and equal and 3 centimeters. Keep looking. And reactive to light. And now look at my finger. And accommodating. Okay, and also I want to do your motor muscles for your eyes. And just without moving your head, you just watch my finger. Okay. Cranial nerves 3, 4, and 6 are intact. Now I'm going to ask you to cover this eye. And then when you see my fingers wiggling, you just tell me that you see them. You gotta keep looking at my eye.
I see. I see him. I see him. I see him.
Okay, I'm gonna do the other eye.
I see him. I see him. I see him. I see him.
Okay, so that's cranial nerve 2 is intact. I'm gonna check your ears. And there's no excess cerebrum. And no drainage. I'm going to ask you to close your eyes and tell me if you hear something and which side is it on, okay?
The right side. Left side.
Okay. And cranial nerve 8 is intact. And then I'm going to ask you to close your eyes one more time, and I'm going to touch a spot on your face, and you just tell me where you feel it. Okay?
Forehead.
Keep your eyes closed.
Cheek. Other cheek. Chin.
Okay. Cranial nerve. Also, I want you to raise your eyebrows, and then smile, and puff out your cheeks. Alright. Cranial nerve 5 and 7 are intact. I'm going to look at your nose. And it is symmetric, no drainage. And can you cover one nostril? And the other one? Alright. Nasal passages are patent. And then we're going to open your mouth. So your tongue and say ah. You have to say it. Okay. And then stick out your tongue and move it all around. Like up, down, side to side. Alright. Teeth are intact and in good hygiene. Your uvula is midline, rises with phonation. And go ahead and swallow for me. Okay. Cranial nerves 9, 10, and 12 are intact. Okay. I'm going to try to push your head against my hand this way. Like turn it. Okay. And the other way. And then try to shrug your shoulders. Look up. Alright. Cranial nerve 11 is intact. And then I'm going to check your lymph nodes. So this is your submental, submandibular, tonsillar, preauricular, postauricular, occipital, anterior clavicle, posterior clavicle, and then kind of shrug like this, and supraclavicular. Okay? Also, I'm going to check your carotid. Distance. And the other side. Okay, and I'm going to have your range of motion of your neck, so just look up, and look down, to the side, and to the other side. Good. Alright, I'm going to ask you to put your knees over that side of the bed so I can listen to your lungs. Okay. Your spine is straight. No abnormalities noted. Take a deep breath. Alright. Thoracic expansion is symmetric. Take, say 99.
99.
Okay. And vocal fremitus is symmetric also. I'm gonna tap on your back and you just tell me if you feel any tenderness, okay? Any? Good. Alright, I'm gonna listen to your lungs, and so each time I place my stethoscope, you just take a nice deep breath in through your mouth and out through your mouth, and then when I move it, you do another one, okay? So go ahead. Oh, sorry. Good. I'm gonna listen up underneath your arm, okay? So take a nice deep breath. Out. And on this side. Good. Your thoracic area is 1-to-2 ratio, anterior to posterior to lateral. Your respirations are regular and unlabored, no accessory muscles noted, no cough noted, and that's good. I'm gonna place your knees back over this way. I'm gonna listen to the rest of your lung sounds up here. Let's go ahead. And now I'm going to listen to your heart sounds. So I'm going to say which valve I'm listening to, and you don't have to breathe or anything. And this is second intercostal space, right sternal border, aortic valve. Second intercostal space, left sternal border, pulmonic. Third intercostal space, left sternal border, Erb's point. Fourth intercostal space, left sternal border, tricuspid. And then the fifth intercostal space, mid-clavicular line, mitral. Okay. Go ahead and lay back for me, just all the way to the top. All right. Here, go ahead and lay straight. There you go. And can you tell me last time you had a bowel movement?
Last night.
Okay. And any problems with it? No constipation, diarrhea. What about last time you urinated?
This morning.
Okay. And no burning, no painful urination? Good. All right, I'm going to listen to your abdomen. And your abdomen is flat, and bowel sounds are positive, normal, active, and then I'm going to palpate, okay? You just tell me if you feel any tenderness. Good? Okay, I'm going to try to go down. No, stay seated, or laying down. And arm muscles are firm, and no edema, skin is warm. Same thing with the legs, no edema noted. I'm going to check your brachial arteries. And your radial. Okay. gluteal. Your posterior tibialis. And dorsal pes. Okay, I'm gonna go straight for me. And ankle clonus. Okay. And can you pull up against my hands? Like try to pull your ankles up and then push. Good. Capillary refill is less than 2 seconds. Let's see this finger file. And here. Plantar reflex. It's good. And you can go ahead and sit up for me. I'm going to check your reflexes while we're sitting. See if you can scoot back to the edge of the bed to where you're in. There you go. Okay. That's your patella and your Achilles. And then I'm going to check your tricep and just let your arm go limp, like dead weight. Not dead weight yet, I can tell. You got a lot heavy